Namaste. Are you someone who has developed a double chin and are frustrated by it? It is not going away no matter what you do. You've tried all kinds of diets, you have tried working out, but still this double chin is there which annoys you, and you remember what you used to look like with a slim jawline and you want to get that back. I'm Dr. Aniket Venkatram, plastic surgeon from the Venkat Center for Skin, ENT and Plastic Surgery, Bangalore, and today we will talk a little bit about double chin, what it is, how it can be treated. So the first question obviously is, what is a double chin? Why does it happen? A double chin is the term given for this extra amount of fat here below your chin. And it's called a double chin because when you look down, it bunches up over here and it looks like a second chin, and this is what is known as a double chin. Now this is frustrating for many people. Why does this happen? It can happen for basically three main reasons. The first is weight gain. When people gain weight, they gain fat in their body, and this is one of the areas where that fat deposits. The second reason is hormonal causes. There are hormonal conditions such as PCOD, also in some cases diabetes, thyroid conditions, especially hypothyroidism, which predispose to a buildup of fat in this area. And third, getting older, aging. As you get older, you lose fat in the upper part of your face, you gain fat in the lower part of your face. So your face goes from being like this to being like this. So these are some of the reasons why a double chin happens. Now the next question is, why is it so difficult to get rid of? This fat is usually very stubborn. What do we mean by stubborn fat? Fat anywhere in the body can have receptors to two kinds of hormones. They can either be fat gaining hormones or fat burning hormones. Those fat cells which have a higher number of receptors to fat burning hormones is the fat that can be burned away easily. Those fat cells which have a higher amount of receptors to fat gaining hormones are the fat that is difficult to burn away. This is why when you work out, you see that you have fat loss in some areas but not in other areas. And this area is one area wherein the fat cells have very few receptors for fat burning hormones and they have more receptors for fat gaining hormones, which is why this fat is so stubborn. It can be removed by exercise, but it would be among the very last fat in your body to go away. You would have to exercise a lot, and usually people in their daily lives, they don't have this much kind of time and effort to be able to do this. This is one reason why this fat is so difficult to burn. The other reason why it is so difficult is, as I said, hormonal conditions are a common reason why fat here accumulates. If you have conditions such as PCOD, if you have conditions such as diabetes, hypothyroidism, all these conditions have hormonal influences for this fat buildup over here. And that is again one reason why this fat doesn't behave like fat in the other parts of the body. So what does this mean? Does this mean that there is no way to get rid of this? No, there is thankfully a very easy solution for this. We can do something called liposuction for the double chin. Liposuction is a process of removing fat. It is done by making a couple of small holes. In the case of a double chin, we make a couple of small holes here at the angle of the mouth, and if needed, one small hole here in the middle. These holes are around 3 to 4 millimeters wide. Through these holes, we give the anesthesia and we use small metal tubes to suck out the fat. Usually, this procedure is done under general anesthesia. Our specialty is that we do this as an awake procedure. It is awake liposuction. We only give anesthesia in this area and you are otherwise awake. The advantages of this are, one, it makes the procedure very safe. There are no risks of general anesthesia, which is particularly useful, like I said, in individuals with hormonal conditions, individuals who are obese and such. Secondly, because you are awake during the surgery, we can make you stand up, see how it is looking, make you lie down, do some more liposuction. This improves the result because things look different when you're lying down and when you're standing up. And thirdly, it makes the recovery very fast. You can be back to your work and your daily activities within 3 days. Now, there are some things to remember while doing liposuction for the double chin. The chin is a difficult area to do liposuction in. It's an area where you want to be safe. Firstly, obviously, there are important structures in the neck which have to be taken care of. Secondly, there are some important nerves which run near the jawline, and these have to be taken care of. So, if this is not done properly, you can have temporary or permanent nerve injury, which can cause the angle of your mouth to go in one direction. You can have blood collection, stuff like that. Which is why it is very, very important that you find someone who is well trained and well experienced in liposuction for the double chin. Now we are going to have a look at some examples of results of patients with double chin who underwent liposuction at our center. Now, a couple of questions that people often have is, one, will this double chin come back? As long as you maintain your weight and your hormonal conditions are under control, it should not come back. If either of those issues goes out of control, then yes, fat can build up here again. So it is upon you to maintain the results. The second question is, what is the recovery after this procedure like? Well, there is some swelling initially after surgery, but that goes away very quickly. You can be back to work within 3 days, especially if you're doing it under local anesthesia, if it's an awake liposuction, as I said. Now, immediately you will see the result, but that result gets even better and better over the course of time because two things happen. One, there's a little bit of loose skin which has to stick. So we give you something known as a compression garment, a head strap that you have to wear at night for around a month. Secondly, apart from the fat which we physically remove, there is some fat which we would have damaged but not removed. That damaged fat gets broken down and excreted by your body, and this procedure can take around 2-3 months. So the full result takes around 2-3 months, but you can make it out immediately after the procedure as well. I hope you found this video about liposuction for the double chin informative. If you have any questions, do feel free to get in touch with us. Our information will be coming up on the screen shortly, and it is available in the description below. As always, if you like our videos and you want more such content on all things related to skin and plastic surgery, do like this video, do share this video, and do subscribe to our channel. Thank you. Have a great day.